Computer. This one's about safeguarding adults. I want to aim it more at level 5. I don't want to repeat the stuff that you already know, which is about science of abuse, the different types, all of that lot. However, we do just need to look at the defining safeguarding. And defining safeguarding looks at who is deemed vulnerable. And basically that could be anyone that needs care or support, who is in local authority or may not be in local authority, but they are somebody that is vulnerable. In other words, they're experiencing potential abuse or at risk of abuse and neglect. So I just want us to spend a minute to think about who are the vulnerable groups of people in which are in our society. So not within our home, because I want us to think more level 5 out of the box. So who are the vulnerable people in our society?
The people that are living themselves,
So people that are on their own, yeah.
Yeah, the oldest people.
Pregnant
So
women.
Yeah. So what was that? Sorry.
Pregnant.
Yeah. Yeah. Anyone else?
With health problems.
People with underlying health conditions are vulnerable. Yeah.
Children.
Children are vulnerable. Yeah. Keep going.
Ourselves are vulnerable.
Staff are vulnerable. I'm quite happy for us to be in that category. Yeah. Any more? A few more to think about. What about people who are addictive personality? So addictions. Who might be vulnerable in those groups? So if we think about drinking, would they be in a vulnerable group? So alcoholics, substance users, gamblers are all in a vulnerable group because they prioritise people that use their computers beyond unreasonable timeframes are vulnerable because they're making poor choices, putting their health at risk.
Gamers? Are the gamers vulnerable?
Gamers are definitely vulnerable now. It's the most increased common addiction in the United Kingdom. And we've now opened up 2 clinics in the UK for children to help them to come off gaming. And that's because they're on it for long periods of time. It's affecting their mental health and well-being. It affects their sleep. It affects their concentration. It affects their social interaction skills. So it is causing a huge impact and vulnerability amongst the young people. And that's why we see a massive increase in CAMS. Because again, poor choices are being made. You know, and when you think about some of the things that they're watching and interacting, so age-appropriate gaming is fine, but a lot of the young people are playing games such as Grand Theft Auto, where you've got people driving around killing prostitutes. So what does that teach somebody who's 10 years old? Is that okay to do in real life? So the reality is we've got these age-defined categories and impressionable minds. You know, we know from the Bobo doll experience that young people are impressionable. If they watch something, they can follow it through. That's why we have age-restricted items. So gaming is definitely a massive problem in children and young people, massively. So somebody who prioritizes their addiction above others, who makes it the thing in their life, is a vulnerable person. Okay. Who else could be vulnerable?
Those that are watching the internet in general.
Yeah, probably. Yeah. Think about more people in our society. So our vulnerable group of society. Quite common in Amsterdam and Belgium. They have legalized versions of this.
Guns?
No, not guns, but that would definitely make you vulnerable if you're caught up in gangs. Gangs would make you a vulnerable person. So prostitution. So known prostitutes are in the vulnerable group because again, exploitation, modern slavery, vulnerabilities. and homelessness, because again, if you're homeless, it's very difficult for you to get health and benefits and the welfare and the care and the support that you need. So when we think about vulnerability, all we ever really learn is the categories of what abuse is and what it looks like. We don't really look at, in our society within health and health inequality, how difficult it is to get the help and the treatment that you need, and how vulnerable a large proportion of our society is. So the reality is, what we've basically said is anybody could be vulnerable at a time in their life. And we have all had times where we have felt more vulnerable than others. We've probably all had times in our lives where we've allowed people to manipulate us, where we felt less powerful because we were tired, fatigued, exhausted. So at any time in our life, anyone can become vulnerable. So when we talk about vulnerability and safeguarding, what we're saying in healthcare, regardless of who you are, do you have an underlying vulnerability which makes you more at risk than others? So if I were to be meeting you in an accident and emergency clinic, what would make you more vulnerable? And all of this starts to build a picture around vulnerability. Okay, so that's where I want us to be thinking when we talk about safeguarding. And equally, it looks about the fact that they're unable to protect themselves from the risks that they're experiencing. So again, if we look at addiction, it's very hard for them to protect themselves because they're so reliant upon what they're addicted on. And the problem with that is it can cause a knock-on effect, can't it? It can cause financial problems because we're paying for substances or we're paying for things that we simply can't afford. So we're making those unwise choices. If we're taking substances or we're up on our computer games all night long and we don't have our jobs, it makes us unemployed, which then causes a problem with housing. So then that causes a vulnerability with health. If we're not sleeping, we then make unwise relationship difficulties. So we can start isolating. So we can look at one vulnerability in safeguarding and how it can pretty much spiral out of control really quickly for people in their lives. Equally, with vulnerability, it makes people more easier to manipulate and abuse, doesn't it? Because if I know you need money for something, I don't necessarily have to steal it from you. I can manipulate you to do modern slavery, sex trafficking or sex work, or drug carrying. So we can easily see how somebody who's made unwise choices ended up in a situation where they're vulnerable, but they don't recognize they're vulnerable. They're unable to protect themselves because they don't see themselves as vulnerable, but others and predators do see them as vulnerable, and therefore it exposes them more at risk because they're now extremely vulnerable because they've now got an addiction that they're trying to sort out and a problem, plus the risk of society seeing them as an easy target. And ultimately, and all of that ends up in abuse in one way or the other, and ends up in what we normally see as self-neglect as well, because we stop caring for ourselves properly, we stop washing, we stop eating, or we're prioritizing our money on those unwise choices. And it just spirals and spirals and spirals. And therefore, it makes it really hard to identify what the actual underlying cause is. And this is why people keep falling through the nets. Because if it's an addiction problem, then you need help with addiction. But is it that, or is it finances and that lot, which is social care? And then you can see how people quite happily fall through the net. So we're not thinking about your homes, we're thinking about safeguarding and vulnerability on a much, much wider level at level 5. 6 key principles that underline safeguarding. One is about empowerment, so making sure that people are being supported and encouraged to make their own decisions. Prevention, so looking at prevention is better than cure, looking at those things that we can do to stop people. So if we know that they're making unwise decisions, what preventative measures can we be putting in place? How can we be supporting people? How can we be giving people the opportunities that are maybe homeless, who can't access the COVID treatments and the flu vaccinations and the healthy meals? How can we help them to be more empowered to look after themselves, because again, they're more at risk of on-street violence and crime. You know, they're at risk of poor health conditions because of the weather. So lots of things there to think about. Looking at the risk that's being presented, so the proportionality, looking at the responses there, protection, looking at how we can protect somebody, working in partnership across local authorities, and then accountability and transparency in delivering safeguarding. So the 6 key principles when we talk about safeguarding, it's about helping that individual, empowering them to see that they are somebody who's vulnerable, looking at what can we do to get them out of that vulnerable category. So, you know, if they are a sex worker, what can we do to support them, to help them to move from one category to another? Is it education and training? Is it the fact that we can upskill them? Could we potentially move them and rehouse them? If they're caught up in substances, do they need to do rehab and detoxing? You know, because actually, which problem are you going to deal with first? So it's quite a prolific problem. It's very complex. Prevention, let's not get these people there in the first place. What can we do to stop homelessness and sex work and substance taking? You know, do we do enough around it? We've got enough campaigns about smoking. We've got campaigns about drinking. Do we have campaigns about gaming? No, I've not really seen any. Do we have campaigns about not sex work and all of that lot? No, I don't see them. So there's a lot more we can do about all homeless. You know, do we have any real preventative campaigns saying if you're homeless, these are the things you can do to stop yourself? So there's lots more in society that we can do to prevent. Proportionality is that risk. It's looking at what are the strategies versus the responses. The protection there is look at, well, what can we do once they have been identified as vulnerable? So, for example, if you go homeless, you lose your GP. Does that seem right? That's probably the time you need your GP at the most, right?
Mm.
But so you can't register with a GP if you haven't got a fixed address, can you? I can't even get a dentist, and I'm of working age. So, you know, there is health inequality. And again, health inequality comes also at if you can pay for private or not. You know, if you have to pay for your glasses and your dentistry work, you're more likely to have eye problems and denture problems because you can't afford it. And if you have to pay for your prescriptions, can you afford your prescription? But people that don't work get their prescriptions funded. So there's real health inequalities here, isn't there? Protection, obviously, what can we do? You know, is it as clear and as transparent as what it is? The answer is no. I think we have probably one of the most complicated care navigating systems in the world, because when you hit care, you are pushed from pillar to post, aren't you? You trying to get an answer from somebody, oh, no, that's not a healthcare problem, that's a social care problem. You need to get a social worker. All right, have you tried to get a social worker? You know, it's ridiculous. We just don't have easy access points. Partnership working is all about who are the charities out there? What are the organisations that can bring this together to reduce that inequality that we have around vulnerability? Because if we tackle the inequalities, we can tackle safeguarding principles a lot better. And finally, accountability. Who actually is responsible for all of this? Because it always feels in social care, we're the ones responsible for everything. And I don't think that's the way it's meant to be. I think there's meant to be a much wider accountability across boroughs, pan Londons or pan city centres and across the country. And it doesn't seem right that if you live in a richer postcode, you are more likely to receive better care and better support than if you live in a postcode that's got an area of deprivation. So, for example, if you live up in Blackpool, it is much harder to get healthcare and treatment than what it is if you live in the southeast. So these health inequalities cause basic safeguarding principles. And actually, who is responsible for that? And I'd like to think the government. You know, the government should not be allowing inequalities in our healthcare system. So that's the level we're on when we talk about safeguarding. We know under the categories of abuse, you know all of these. There's none on there that we've not seen before. All I want us to think about here is for every direct, there is an indirect. Okay, so for physical, I can directly hit you, or indirectly, I could tell you to go to a room. So there's a direct and an indirect for each of these. Domestic violence, I could punch you, I could swear at you and belittle you, or I could emotionally abuse you just with words. So direct, indirect. Sexual, I can touch you inappropriately, or I could rape you. Alternatively, I could show you pornography, or I could do dirty jokes that makes you feel uncomfortable. Direct, indirect, okay? Psychological, we can go down the whole mind playing game, making you feel bad. You know, I could be tripping you up, making you do things, making you think it's you. Alternatively, I can be playing those games in the background. Financial material, I could be taking and stealing from you, or I could be restricting you from using your money. Because the reality is, people in care homes, when they go, oh, can I have my haircut? Oh, you haven't got any finances. So, well, where's all my money gone? You know, haven't I got money for a newspaper or a haircut? Modern slavery, direct, indirect, I can make you work for nothing or not. Discriminatory, direct, I can just insult you directly, or I could be going around the houses doing it. Organisation, it could be direct. I could be saying, these are the policies and procedures, you must follow this. Indirect could be that actually I didn't mean to cause harm, but it just happens that that's the procedure doing it. Neglect, I could do it accidentally, or acts of admission, I've done it intentionally. I've gone out my way to physically neglect you. And actually that's called willful neglect. Self-neglect, same thing. Self-neglect, I don't need to clean, wash or care for myself, or I could just starve myself and not do anything. So we need to think about, even though we've got these categories of abuse, at level 5, we're going much deeper, you know. So when people go, it was just a joke. Is it or isn't it? And the reality is, at level 5, we have to look at the impact. You know, was that person vulnerable that you told the joke to? Were they able to tell you to stop? Were they able to understand the content of the joke? Or was it just an inappropriate joke? Because a lot of the time when I talk to people, they go, but it was a joke. And, you know, if you look at the recent things with Jimmy Carr, I don't know if you've seen that on the TV at the moment, he's been on the news. He did a Holocaust joke. And it was about the Roman traveling gypsy community. He's going, it's just a joke. But obviously, if that's directed at you, or you know people who are Roman gypsies or who were involved in the Holocaust, or Jews, to you that's really offensive, and that could be quite psychological abuse, couldn't it? So the reality is, we have to think about, is this appropriate or is it not appropriate? And when we look and we do safeguarding, we're putting that hat on. Was it appropriate? Is it proportionate? Is it justifiable? And if the answer is no, you've probably got a safeguarding concern. Okay. Does that make sense? So identifying abuse, lots of things that you can look for. You know, I'm not going to go through all of those, but we know for each of those categories, there's a whole army of things that we're looking for. Change of behaviour, bruising, inability to pay bills, bleeding, you know, pregnancy when it was unplanned, weight loss, pressure sores, people being dirty, moisture lesions, inappropriate behaviour in comments, inappropriate behaviour. What you normally find in younger people that have been sexually assaulted is they have over sexually advert behaviour. So there's lots of things in which younger people will do because they just don't know what they're doing is wrong. So again, all of that will be signs and symptoms that something's not right. When we obviously look at the disclosure for abuse, or we're suspecting reporting abuse, obviously we need to find a private and appropriate place to have the discussion. We need to keep that poker face because we don't want to show that we're being judgmental. We need to keep a very prone face. We need to listen very carefully. Now, you're not allowed to ask questions because if you ask questions, it's seen as an interview. And if you're doing an interview, the first interview is normally the piece of evidence that the police do. And if you do an interview, you could contaminate the evidence for a police investigation. So we never ask questions. What we can do is what's called as the free flow. So I could say to you, you look upset, is there something you want to tell me? And I can let you talk. What I can't do is question you, because if I start questioning you, that's an interview, and it means I've contaminated the first source of evidence. Okay, so we don't ever question somebody. We don't start probing. We allow the free flow. The person starts talking, we write it down, what they tell us, and that's it. That's not an interview, that's just a statement. If, however, we ask questions, that's an interview and we're contaminating evidence. We don't want to do that. So we just allow the person to talk. We obviously don't confront anybody. We ensure that we report to the appropriate authorities. We demonstrate that sympathetic approach, acknowledging what they've got to say. We obviously inform that it's going to be taken seriously. We give information about the steps we're going to take. So we're going to be quite clear and transparent about what we're going to do. We're going to give them feedback as a result of their concerns, and we'll give the person contact details so they can report any further issues and ensure that the people within your organisation is notifiable. So in every organisation, you must have a designated safeguarding officer. So who is your responsible safeguarding person? So obviously you get to decide whether or not you feel there's a criminal offence going on here. So if it is a direct sexual assault, or you are concerned about somebody's health and well-being, then you absolutely have the right to call the police. Alternatively, you would contact your local authority team, because again, you absolutely have the right to contact your local authority team. And then finally, you can contact CQC as well. So there's 3 external agencies in which you can contact, which is the local authority team, police and CQC. So it's important for you to know your home's policy, but equally, if you are concerned that your home is colluding or covering things up, you have the right to escalate that safeguarding concern and make it more known. Obviously, under the Mental Capacity Act, you need to make sure that we've got the 5 key principles, but just because somebody doesn't have capacity doesn't mean we're not going to listen to them or take it seriously. So again, we assume everyone has capacity. We make sure that the individual is supported in making their own decisions. The individual retains the right to obviously make unwise choices, and all decisions should be made in the person's best interests, and obviously should be least restrictive interventions. When we assess the capacity of somebody, we're making sure that they're able to weigh up the decisions, that they understand what they're telling us, that they're able to retain the information that they've told us. So again, if somebody's just giving you the whole statement about what's happened, I would paraphrase that back to them and say, so can I just confirm what you've told me is this, am I right? Just to confirm that understanding, so you know that they're doing it. Weigh up the information. And it is really important that you do this bit. And it's important that you use the phrase, what you've told me is a safeguarding concern, and I'm going to have to report this. You need to be transparent with that, because you're not going to hold back any secrets. You can't not report it, but they may genuinely not have understood what they were telling you. So for example, I had a service user that I looked after a good 10 years ago, and she was 69 and an alcoholic, and she said to me, I'm starting to see somebody. And I said, well, that's fine, you're entitled to see people. What transpired was she was seeing the night worker on nights. He was going into her room, having relationships with her. Now, she obviously didn't realise what she told me. She genuinely thought this was absolutely fine. And it was only when I sat down and she started to say to me the intimate things that they were doing that she hadn't weighed up any of the risks there. So it's really important that you are transparent with that. and obviously to communicate the decisions that are made. Now, alongside all of the safeguarding principles, we've got our prevent strategies. Have you heard of prevent? No. So prevent strategies came into force back in 2010, 2015, maybe, I can't remember, but it's been a while now. And the prevent strategies is all about identifying acts of terrorism and radicalisation. So here, in the health sector, we must make sure that we're safeguarding vulnerable people to influencing external agencies. So, for example, right-wing groups and obviously people being recruited to carry out acts of terrorism. And signs of prevent, what we're looking for there is extremism. Okay, and extremism can take place in many shapes and forms. What we tend to see with extremism are people that follow symbols, and they're very strong in their views and their opinions, and they're always right, and you can't move them, and it's the only topic that they're talking about. So, for example, if you think about the Nazi symbol, that was quite a powerful symbol in World War II. A lot of people followed that symbol. It had a lot of ideology behind it. And that's kind of what we're talking about, radicalization. So there are groups out there that claim to say that they're doing good for the community. They use logos and symbols to attract people to them. But actually, are they just recruiting vulnerable people that don't understand the ideology behind what they're doing? And I think, you know, we can all think of maybe 2 or 3 activist groups that are out there that are gluing themselves to the ground and doing all of this stuff. And we have to go, is that extreme? Is that behavior just too far? Yes, you have the right to peaceful protest. Yes, you have the right to a voice. But do you have the right to disrupt the travel of everyone else on the planet? Do you have the right to put people's lives at risk by blocking emergency services? Or is that now an extreme behavior? And the reality is we have to look at extremism in that way, which is we have to stop radicalization regardless of what it is, because our job is to protect vulnerable people. So if somebody wanted to join a group, that potentially becomes a safeguard. Do they understand the risk? Do they understand the consequence? Are they going to be used as cannon fodder? You know, it wouldn't be difficult to manipulate somebody who's vulnerable to glue themselves to the floor, would it? So we need to make sure that people aren't being radicalized. And equally, you normally find it's the vulnerable groups. And it's the vulnerable groups. And if you look at the recent one where that young lady went to, if I can't remember where it was, the Gulf War, Taliban area, she went over there, didn't she? Everyone died. She came back and she was trying to say, but I was a child at the time. Was she groomed is the argument, but did she understand the risk and the consequence? And therefore, it's a real difficult situation to be in, isn't it? Because at the time, she was a minor. She probably had been groomed and therefore was vulnerable. So was she fully aware of the choices and the rights that she was making at the time? And then to go through all the losses of the children and all of that lot, does it make it proportionate or right? Or had she been failed in safeguarding in the first place? So it's really difficult. We don't, for us, it's all about providing that information and not being judgmental and looking at strategies to help prevent things. And that's what prevent's meant to do. Vulnerability factors around prevent obviously looks at the radicalization is a process, it's not a one-off event. So we call that grooming. Grooming can happen over a long period of time. People don't realize that they're being groomed. In other words, they're being manipulated to do things that they didn't know that they were doing, because actually they're being told what they're doing is right. So grooming happens a lot in young people, but also happens in vulnerable single people because they want to please the person in which is grooming them. And that happens quite a lot with cuckooing as well. And do we know what I mean by cuckooing?
It's a building up, is it?
Kind of. It's where So cuckooing would be, you've got your own house and I've now come in and taken over your house like a cuckoo. And basically what it means is in the community, cuckooing happens all of the time. So you're an elderly, vulnerable person, you're by yourself, I come in and say, oh, look, I'll help look after you, give me a room upstairs, blah, 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 blah. And before you know it, I'm in your house, I'm selling drugs and I'm using your house for whatever I need to use it for. And it happens a lot. We see it a lot in London. I've seen it several times in London, to a point where I even went into one home and the lady didn't even know she had somebody upstairs living there. So it happens a lot. And again, happened over a period of time. He'd come in, he cleaned the garden, helped her out, and the next thing you know, he'd got a key cut and was living upstairs because she was bedbound. She obviously couldn't move. It's not about race, it's not about religion, and it's got nothing to do with ethnicity. So this isn't about stereotyping any groups. It is about preventing exposure to vulnerable people. We need to look at engagement when people start to try and radicalize people. It's always about feelings of injustice. It's about stoking those fires. It's about a cause. Then we look at the intent, so we look at the ideology. Why are you trying to convert people? Does the means justify the end? Is it harmful? So this is what I'm talking about. If we're gluing somebody to the ground, is that harmful to them? You know, what happens to them with their skin? What happens if a truck hits them? Is it, you know, did they do that free and willing, or is this grooming over a period of time completely radicalized the way that they think? So again, and then finally, capability. Is the person, you know, do they understand? Do they have the skills and knowledge? And are they aware? And do they have networks? So what we can do, obviously we need further training and awareness, because I think safeguard training focuses too much on types of abuse and signs and symptoms. It doesn't go wide enough. And I think when you think about all of your training that you've had in social care, it's all been about the elderly who sit in your homes and what you could do to them, and what people could do to them. And actually, it needs to be much wider than that. And just, you know, that last half an hour of what we've talked about has made you think about safeguards, and hopefully in a much wider context than what you have before. It is about information for people, and it's about ensuring people understand their rights, because again, it's so easy to take away people's rights and choices. Consider reviewing chronic diseases. So again, if we're looking at terminal illnesses, about the choices people make and advanced decisions, are people being given the opportunities to decide what's right for them and not right for them? Follow up when people don't attend. So if you've got somebody that's meant to have an appointment, if you're working in the community and it doesn't happen, follow it up. If you are a prescriber, you know, there's only so many repeat prescriptions you should be doing before you should see somebody face to face. Policies need to be a lot clearer. Flag records for vulnerable people. So if somebody is vulnerable within your service, so in healthcare, flag it up, because we're not talking about your homes. This course is beyond your homes. You would flag that to anyone. Discuss your concerns and significant events. If you see stuff, hear stuff, discuss them, and obviously contribute to meetings. So when you are working in a multidisciplinary way, make sure you are speaking up for people. In practice, we should then have safeguarding adult policies and procedures. Now, one of your tasks at level 5 is to review your policy in your home, okay? So you should be able to review your policy and decide, is it fit for purpose? Does it cover all the stuff that we were talking about? And remember, it's not just the people in which you look after, but also the family members. So family members may be coming in as vulnerable. So it's about that as well. Identifying who your safeguarding adult leads are. See the child behind the vulnerable adult. So if you are looking after children, and this has happened a lot in community work, because you go into people's homes, you can see children in the background, and I've raised several concerns in my time. Highlight records of vulnerable adults and inform information available for patients. So again, all of that information about what to do, domestic violence, your rights, and kind of pointing things out. So if you believe that someone's got a substance misuse, for example, providing some information for them so they can start to come to terms with the fact that maybe they have got a problem. Significant events reviewed. So if there is an incident, maybe someone's come with a bruise or whatever, we manage that. Share your concerns with the CCGs. So your CCGs are your county local governance committees. So it's your different foundations, your NHS trust, because they're all different. Understand the Mental Capacity Act. So the Mental Capacity Act must be understood. So the Mental Capacity Act 2019, the revised one that falls in line with the new LPS, you must understand that, because as assistant practitioners, that's the law in which you are going to deprive people of their rights. So the LPS, the Liberty Protection Safeguards, it's in your training further down with your, I think it's an independent session, but the Liberty Protection Safeguard Act, which is replacing DOLS, underpins everything. So it is a new, it came into law in 2020. It was another one of those things they brought in COVID, but it underpins everything we do. Minimum safety criteria for staff and employment. So again, looking at all of those prevent strategies and looking at those behaviour and challenging and hazardous behaviour principles, and obviously make sure that your complaints and whistle policy is fit for purpose. So your complaints and whistleblowing policy is another policy in which you need to review. So there's several policies for this course that you must review. So when we have the professional discussion, you can say, I reviewed that policy, this is what I saw, I thought this worked, I thought that didn't work, and these were my recommendations. You don't necessarily have to enforce it, but what you have to show me is that you're not somebody that goes, I follow the policies and procedures, because we all know policies and procedures don't work unless they're reviewed and unless they're local to your home or service and unless people understand them. Final thoughts. It's not your responsibility to decide whether adults are at risk. It's your responsibility to report it if you feel it or think it. Safeguarding adults from abuse is everyone's business, and children, obviously. Do not ignore your concerns. Let the abuse of the adult person know, let people know, and don't forget to apply the Mental Capacity Act principles. What you don't want to do is get through to it and then somebody go, but that person lacked capacity. So that is the end of that. Is there any questions on safeguarding? No? Happy with that? Online, there's some other work, there's some things to read, some videos to watch, which covers all the basics of safeguarding. But the idea of that session is to just make you think much wider about vulnerable groups, how people are manipulated, the prevent strategies, about grooming, a bit about cuckooing and understanding how people end up in a vulnerable situation, and then some of the things in which you can do to have those protective and reactive strategies in place. And obviously what you need to do now is go back, look at your policies and procedures and go, do our policies and procedures, do they cover the wider scope of what we've just discussed? Are they inclusive of the people in which we look after, the family and staff? Your staff members, 1 in 4 is probably experiencing some kind of abuse of some kind somewhere in their lives, whether it be domestic abuse, whether it be substance abuse, whether it be emotional abuse. The people in which we work with are just as vulnerable, because we said that earlier, didn't we? We said staff are vulnerable, and yet we have no practices for reporting abuse if we think our staff are being abused. Or you might have, I don't know. I don't think there is. I've never seen a policy. Do you think of work colleagues being abused? If you do, follow these processes. And again, we can spot staff's behaviour, can't we? Sometimes you might smell alcohol in a member of staff. Maybe you think their eyes are a little bit wide open. Maybe you think they've been smoking a joint. But ultimately, if they're substance using whilst at work, they're vulnerable and something's not quite right. It doesn't mean that they should be dismissed and sacked on the spot. It means that there's a safeguard there that should be looked at. So I just want us to think at level 5, we're thinking a little wider. Anyway, thank you for bearing with me today. I appreciate that's been a long old day of me talking at you again. Next week, you'll be pleased to know we're halfway there. But like I've said, you're doing it for this badge. That's the badge you're going to get. Look, oh, it's a lovely badge. It's a lovely badge. I've had them made specially for you for your uniforms. And when I come out to see you, you'll get your first certificate. So I appreciate it's a lot to go through. What you need to do, you do need to log on this week and you need to follow the challenging behaviour module because there's a lot on there. Okay.
Yeah, Steve, all the recorded video, is it on the canvas, all of it?
Yeah. Let me show you where it is, just so you know. So when you log in, all of the recordings, it takes, so these recordings won't be ready until tomorrow because it takes a whole night for them to buffer and do what they need to do. But basically what happens once the session's been delivered, so if we go back to week 1, so we click on week 1 and it says assessment tools recording, care plan recording. So where it now says recording, enablement recording. So that's the recorded sessions. That's the videos of these sessions. You can go back and play them.
Okay.
Yeah. So what you'll see tomorrow when you click on here, week 3. So if you think last week we did stomach care. You got stomach care recording. So that's last week's.
Okay.
It'll say preventing managing challenging behaviour recording. And that'll be the video of this session.
Right. Okay.
So again, people that aren't attending need to go back and watch those. All right.
Thank you.
No worries.
Stephen,
Yes,
you said about professional discussion at some point that it's a video somewhere for us to watch.
yeah. So the professional discussion video, I've already done it.
But I can find it.
I think it's a bit further down, actually. That's why. I think it's past all of this.
I mean, I saw the question and what we want from each of it. I couldn't see the video.
Okay. So you've got carrying out your professional discussion and about your observation. So it's after. So when I come out to see you, it's after that week 9 bit when I come out to see you. Yeah. Okay. But we're not going to do, just so you're aware, we're not going to do the professional discussion until the end of the course. So your first observation at week 9 is I'm going to come out and everything we've taught over these last 8 weeks, we're going to practice in the morning and I'm going to do an observation in the afternoon because each skill is about 5 minutes long. So we'll practice, play, then we'll demonstrate and then you'll be signed off. You'll get your badge and your certificate and I sign off your first obs.
Okay.
And then after that, the rest is just self-directed. You just then go through, there's no more classes after that. It's just self-directed. You just click on supervision and appraisal training, watch the video, do the workbook kind of thing. Yeah. So it's only these first 8 weeks where you have to attend these sessions because it's a lot of teaching and learning. We do that reflective bit in the middle and then it's self-directed moving forward. All right. But don't forget, you're not doing essays. You should be thinking about, though, your research project.
Research, yeah.
That's what you want. By week 9, when I come out to see you, you're going to have that plan ready. You're going to say, Steve, this is what I'm going to do it on.
Okay.
Because again, oh, look, week 8, liberty, protection, safeguards. We are doing it. I thought I'd put it in there. We're doing it there, liberty, protection, safeguards. So we will do it. But you may, for example, you may like safeguarding, you may like challenging behaviour, you might like the LPS, you might like suicide, but you may want to do venipuncture. Your presentation could be on anything from this course. All right. Lovely. If you've got any concerns, you can obviously email me through the system.
Okay.
See you next week, everyone. Halfway point. Bye.
Bye.